Hi, everybody. Can you hear me? I hope everybody can hear you. Hi.
Can hear.
Well done. Thank you so much. Okay, I guess everybody's are here, right?
Yes, so I think we can proceed with today's.
Can proceed, huh?
Yes,
Okay,
thank
you.
you.
Yeah. Okay, my topic for today is regarding oral care. Okay, tips on oral care for older adults. So the contents, here what you need to know about age-related dental issues. The contents what are some common oral diseases that elderly tend to suffer with. Treatment for gum disease, the importance of oral hygiene, steps for maintaining oral hygiene, and lastly, dental care. The enamel that protects our teeth is the toughest tissue in the body, but years of chewing, gnawing, and grinding can take its toll. Common oral conditions. Periodontal or gum diseases due to the accumulation of bacteria in the dental plaque result in inflammation and infection of the supporting gums and bones. Periodontitis is common but largely preventable. Yes, it can be prevented. It's usually the result of poor oral hygiene. Brushing at least twice a day, flossing daily, and getting regular dental checkups can greatly improve your chances of successful treatment for periodontitis and can also reduce your chance of developing it. Root caries or cavities formed by bacteria acid attack on the root surfaces of the teeth. Build up of dental plaque, a sticky phlegm made up of salivary protein, food debris, and bacteria when left on the teeth for prolonged periods. The bacteria multiply and excrete acid that attack the tooth structure, supporting gums and ligaments. Sugar feeds these bacteria increase the risk of erosion, tooth wear, or the loss of tooth structure due to friction from chewing, grinding, or from excessive brushing or picking, or chemical erosion from acidic diets or gastric reflux. Endothelialism, or you call it tooth loss due to decay, gum problems, or physical injury. Xerostomia, or normally we call it as a dry mouth, caused by disorders of the salivary glands, a side effect of medication or from radiation treatments to the head and neck. Stomatitis, or the inflammation of infection of the soft tissue in the mouth, caused by frictions from dentures, irritation from spicy or acidic food, allergy reaction to filling materials, or microbial infection. Oral cancer, or the growth of invasive tissue that destroy the normal structures. The cause is unknown, although risks including smoking, drinking, and bitter chewing. Yes, I guess smoking is very something that we have to address of lah. Okay, comes to gum diseases. What is gum diseases? It's a chronic bacterial infection of the gums and the bones supporting the teeth. It can affect one tooth or several teeth. If left untreated, it may lead to the loss of the tooth or teeth. The main cause of gum disease is bacterial plaque, a sticky phlegm made of bacterial and salivary protein accumulation on the surface of the teeth, like I said earlier. Other signs and symptoms, well, shaky teeth, teeth appearing to drift apart from its original position, receding gum line or gum recession, persistent bad breath, vague discomfort, or dull ache in gums and teeth. Okay, these are the risk factors of gum disease that we need to take note of. Poorly controlled diabetic, heavy smoker, like I said earlier, undergoing hormonal changes, taking certain medication. You see, certain medication that you take can affect your gum. A lower immunity against infection. Well, I said earlier regarding about the cancer, poor nutrition. Also, these are the risks of the gum diseases. For treatment for gum disease, most of the time, patients always want to know what is the treatment like, how long will it take for this illness to cure. It all depends, ladies and gentlemen. The type of treatment and numbers of visits will vary depending on the extent of the disease. It is important to maintain good oral hygiene. Smokers are strongly advised to quit smoking to improve treatment outcome. Okay, you may first, if you are a smoker, you may want to reduce the number of smoke, then eventually, hopefully, you can stop totally. Prevention of gum disease. Plaque form within hours after it has been removed from your teeth. Effective removal of plaque can help to prevent gum disease. These are some preventive steps. Brush your teeth. Brush half an hour after a meal. Floss every day. Use an interdental brush on teeth with a larger gap. Visit the dentist routinely. Do not use tobacco product. Why is oral hygiene important? Oral hygiene includes all the processes for keeping mouth clean and healthy. Good oral hygiene is necessary for prevention of dental caries, periodontal diseases, bad breath, and other dental problems. Oral care is also closely related to cardiovascular problems. Yeah, you'll be surprised. For the oral hygiene, if you don't take care of yourself, it may affect your cardiovascular, which is your heart. Okay, oral bacteria can affect the heart when it enters the bloodstream. When it reaches the coronary artery, it can contribute in clot formation, where then eventually you get a heart attack. Importance of good oral hygiene. Prevention is always better than cure. I guess this is very common to us, right? It's good for us to prevent rather than you wait until you got the diseases. Okay, good oral hygiene habits will keep away most of the dental problems, saving you from toothaches and costly dental treatments. Awareness regarding the importance of oral hygiene has significantly increased in the developed countries, but contrary to that, the modern dietary lifestyle habits are posing a greater risk for oral health. Good oral health is important to our overall well-being. Basic steps for maintaining oral hygiene. Well, basically, as we know, you have to brush your teeth, floss your teeth, regular dental workout. I mean, you have to visit the dental. Yeah, then avoid high sugary diet. Okay, eat in moderation. Okay, less sugar. Basic step for maintaining oral hygiene. Okay, basically, if you like to see the slide, actually use a pea-sized amount of toothpaste is more than enough. You don't have to put the whole layer on top of your on the brush. Aim the toothbrush at angle towards the gum line. As you see the pictures, 45 degrees. Okay. Use a gentle circular motion, not just by brushing up and down, left to right, but instead use a gentle circular motion. Repeat on the inside surface. Okay. Inside also you have to do the same. Use a light back and forth motion on the chewing surfaces. Basic step for maintaining oral hygiene. Okay, like what I say earlier many times, do the floss. But remember, you don't have to use a very long floss in order to floss your teeth. I mean, floss in between your teeth. Small, not too long, is more than enough. If it's too long, you tend to injure your gums. Then there's a tendency for you to get to injure your gum and eventually bleed. Denture care. Okay, do not accidentally drop them. Why? Because our dentures is brittle. Once it's dropped, it tends to break easily. Do not use toothpaste. Okay, out there at the pharmacy, they have your own solution for you to wash your denture. Brush and rinse every day. Yes, you have to do it every day. Not today do, tomorrow don't do. You have to do it every day. If you like to keep your dentures in a good condition and you want to use for a very long time. Use a denture cleaner. Some people tend to use a tablet to clean, to put in a cup, and it helps kill bacteria. But you can also make your own solution. All right, you can get all these at the pharmacy. Keep dentures moist when not in use. Like what I say, it's a brittle, so you have to keep it moist. Put it under the water. Comes to the denture care. Ladies and gentlemen, when you see the pictures, all right, you do whatever that how you treat your teeth. Okay, brushing from the outside, inside, and also the chewing surfaces. I would like you to do the same to your dentures. First, brush the one in front, follow with the one inside, and also the chewing surfaces, right? Like what I say, up and down, left to right, and also in circular motion. Do I need to visit the dentist regularly? Why is it important and how frequent should they visit? No need. Is it okay for you not to go to the dentist? Right. One thing that you should know is that regular dental visits are important because they help to keep your teeth and gum healthy. There are two parts to regular dental visit: the checkup, the cleaning or oral prophylaxis. During the dental checkup, your dental professional or dentist will check your overall oral health for any trouble areas. Then from there onward, they will give you a better advice how often you should visit them. But actually, normally, if you have some problem with your gum, with your teeth, then the visit will be quite regular. But eventually, it changed to 3 months or even 6 months. Okay, but as far as I know, spoken to the Dr. Yo, they say every 6 months will be the right period to check your teeth. During the cleaning, your dental professional will remove any plaque and tartar build up and may polish your teeth. You should have regular dental visit at least twice a year. Like what I say, every 6 months, or as recommended by your dental professional. Okay, if you have, if they found out that you have a gum problem, a teeth problem, then normally your visit will be very close apart. But eventually it becomes to to 6 months, six monthly. Facts or myth? Okay. Statement 1. Do you believe only children get cavities? The fact is, tooth decay can develop at any age. It can happen as long as you have natural teeth. Dental plaque, a sticky film of bacteria, can build up on teeth and produce acids that over time eat away at the tooth heart of the surface and create a cavity. Even teeth that already have fillings are at risk. You see, even fillings also can attack. Plaque can build up underneath a cheap filling and cause new decay. And if your gums have pulled away from the teeth, they call gum recession, they expose tooth rows and also vulnerable to decay. But you can protect your teeth against decay. Here's how. Like I said earlier, use toothpaste that contain fluoride. Fluoride can prevent tooth decay and also heal early decay. And it is just as helpful for adults as it is for children. Be sure to brush twice daily. This will help remove dental plaque that form on teeth. Drinking fluoridated water also help prevent tooth decay in adults. Floss regularly to remove plaques between teeth, or use a device such as special brass or wooden or plastic bricks recommended by dental professionals. Well, lastly, see your dentist, a routine checkup. If you are at higher risk for tooth decay, for example, if you have a dry mouth because of medicine you take, your dentist or dental hygienist may give you a fluoride treatment such as varnish or foam during the office hour, or the dentist may tell you to use a fluoride gel or mouth rinse at home. Okay. Do you believe if gum disease is just a part of growing older? I mean to say only older people, okay, or only old generation we have a gum disease. Is this statement correct or wrong? The fact is, you can prevent gum disease. It does not have to be a part of getting older. Gum or periodontal disease is an infection of the gums and surrounding tissue that hold teeth in place. Gum disease develops when plaque, a sticking film of bacteria, is allowed to build up along and under the gum line. The two forms of gum disease are gingivitis, a malform that is reversible with good oral hygiene. In gingivitis, the gums become red, swollen, and can bleed easily. Periodontitis, a more severe form that can damage the soft tissue and bone that support teeth. If it's not treated, the bones, gums, and tissue that support the teeth are destroyed. Well, you can imagine after that what will happen. The teeth may eventually become loose and have to be removed. Yes. The good news is that gum disease can be prevented. It does not have to be part of growing old. Yes. Not all, every age, okay, if they don't look after their gum, will actually become a disease. With true brushing and flossing and regular professional cleaning by your dentist can reduce our risk of developing gum disease as you age. Regular dental checkups, eating a well-balanced diet, and avoid tobacco use also lower the risk. Okay, that's the end of my presentations.
Hello, Samsu. Thank you for the sharing. So now we are
Welcome.
moving on to our Q&A session. So if you have any questions regarding oral care, you may actually on your mic or also type in the chat box so that Samsu will be able to address for all of you. And I also do see a question on the chat. I think it's regarding the denture. Why is it so that for denture we are not allowed to use toothpaste?
Okay, there is.
So
Hold on, something. Okay, actually, a toothpaste, they have their own chemicals, and the best way is to use the recommended solution for you to brush your teeth, because because it's artificial, and I guess to use fluoride or even normal toothpaste will actually affect.
Understand.
In other words, he's trying to say is that it will spoil the denture.
Yes, so I think toothpaste itself, they have this like what Samsu shared, they have this ingredients inside that actually helps to actually clean away our teeth cleaner, right? So for denture, if you want to use it in a long term run, you will actually be very abrasive, too harsh for your dentures. Then you will actually cause a lot of scratches for your dentures as well. In a long term, it actually is not good. So like what Samsu share is like maybe the polydent. Then you can actually soak inside the solution for the polydent and just use a soft toothbrush to actually just wash clean it.
Well, I don't seem to understand why you say that there'll be scratches. You're using toothbrush to brush the denture. Why is there scratches there?
If you are using toothpaste.
Yeah, toothpaste. Let's say for example, we are using our own real teeth. We are using toothpaste, but I don't see any scratches on our teeth.
Because the toothpaste, our teeth and our denture is using of different, it's a two different thing. So our toothpaste is actually meant to use for our tooth. So it's actually when they created a toothpaste, it's meant for the material of the tooth, right? So for example, for denture itself, is using another different type of materials that might not be suitable for a toothpaste.
Correct. Then the other thing is about cleaning with a normal toothbrush and toothpaste can be aggressive because they are artificial, you see, and can cause damages leading to increase in the chance of bacteria forming. Once it is too hard, and then of course bacteria will start to come in and displace looks to your dentures. It looks so irregular and maybe change on the color, stuff like that. Abrasive toothpaste can also increase stain adherence on dentures. It may change.
Okay, thank you.
Yeah.
Okay.
Best is still go back to the dentist or even the pharmacy to get more advice.
Okay, thank you, Samsu. So we have another question. Christina, sorry, I don't really understand what do you mean by the black lump can grow in the gum and after it disappears. Will you be able to on your mic to share a bit more on this question that you raised on the chat?
May I just speak up?
Yes, please.
Like a lump appear in the gum. Then after a few days, it disappears. What causes it? May I know what causes it?
I tell you, when I download the report, it come up 4 pages. I don't know why.
Okay, so Krista, you mentioned that you experienced some black lumps on your gum, is it? And then after a couple of days, it actually disappeared. Okay. For that.
Hi, Christina. I want to ask more. Is it black color? Is it very dark?
Yes. I think actually it happened a few days ago. I felt painful, and I thought because I just ate something hot, quite hard.
Is it,
So
is it one time episode?
Like the color, the black color seems like not so dark. It happened long time before once, but seems like nothing really affect me. So I just I didn't take care of it. But recently, few days ago,
pains, you got pain, swollen.
When I check it now, I a bit swollen, but just within maybe few seconds it disappear.
Okay, so I can advise. So if you see a new spot on your gum, but make sure to tell your doctor about it. But you should monitor for any changes in shape, size, or color. Yes. But sometimes it can be heaty. Heaty also. Maybe you eat spicy food, but so you can drink more water, plain water, and to see whether it helps or not in reducing the lump.
I admit now I add a lot of heaty things. Chocolate.
I see.
Milo. So it's not a serious thing now, because that happened. Is it not serious?
Okay, you have to monitor if it's increase in shape or size or color, is pain and swollen, you need to see a doctor, because by when you mention, so we really cannot see, but if you see a doctor can diagnose and see whether what is the spot, whether it could be dangerous or is it can be a harmless. Yes.
So I can hold on for some time and see, because I also dare not to go to clinic these days. Try not to Can I?
So you see whether is it getting increase in size or shape, or is it pain, then you see a doctor. But Jana, you say no more already, right? If have, then I advise you to see a doctor.
Okay. Thank you very much.
Do you go see dentist every 6 months?
No.
Oh no, so I will advise best that the doctor can check.
Thank you.
Thank you, Christina.
Thank you for your reply. Thank you very much. God bless you.
Thank you, you too.
Thank you, Nashri, for the sharing. So the black lung should be sometimes can be internal cause or external cause. So like what Mr. Nashri mentioned, to share just a monitor first, and if you find that this condition persists, then maybe it was still best advised to see a dentist so that they can help you to check accordingly.
Okay, thank you. Thank you very much.
The one I want like to share how I do for my mom is that if it affect your daily eating, it affect your daily life, then it's good for you to see the doctor. Don't wait. But if it just goes away, you may like what Mr. Nasi say, observe first before going to the dental. To have a regular checkup for elderly, my mom is already 80s, is good to do every 6 monthly. Although I know, I believe you're taking care of your teeth, but it's good to get a regular check. For me, since she still got teeth, she got at least 18 teeth, I saw, but it's good for you to check it out.
Okay, thank you. God bless you and your mom.
Thank you.
Anyone got any other questions you would like to check in regarding oral care? Anyone from also like for those who are in the centers from Depot Heights or Jamaya, if the residents got any questions, you can actually get them need your help to direct the questions to us as well. So we will just do a quick check. How many of us actually go to the dentist every 6 monthly, like what Samsu shared? Any one of you actually
I think once a year will be good enough, right? No need 6 months.
Once a year is a good start, I would say, right, Samsu? So it's a good start. But then we were still encouraged to go for actually a half-yearly checkup, also to do a thorough scaling and polishing also so that the
But nowadays dental is very expensive, One time you go is $100 over.
Yeah, I do agree, but it's more of a essential to actually take care of our tooth is actually very important as well, because by taking care of our teeth, actually prevent a lot of chronic diseases as well, because gum disease actually do affect a lot of our health also indirectly. So it's still good to actually go for a dental checkup. But I was saying, Daisy, once a year is already a good start to begin with.
But to me, to my understanding, my friend told me that you go too often, your teeth will be keep on polishing, and then scaling, your teeth will become thinner and thinner, then you will drop out more faster.
For that, have to I think a dentist could advise you when you go for your regular scaling and polishing, but depending on each person of the teeth itself on how aware of it is as of now. But then at home also, like believe some shall use a softer toothbrush, because the hard toothbrush we assume that you will actually clean off better, but actually it's not. Harder toothbrush will actually brush away your enamel. That is actually very important for your teeth. So a softer toothbrush will clean your teeth as well, but it will protect your teeth from brushing off away the.
Yeah, okay, thank you.
For me to share with, do you know what is a recommended toothbrush for the elderly? Anybody know the answer? Actually, soft brittle toothbrush. Yeah, you can get it at the pharmacy. Soft brittle toothbrush. You may want to write it down. Yeah. Thank you, Felicia.
Okay. Quite a bit of time, so anyone would have any questions or any experience you would like to share with your dentist experience as well? Okay, no worries. If you have no further questions, then we will still be here for another 5 minutes. So if you have for those who have any more questions, you will stay here for a short while more. If you do not have any questions, then maybe we can end today's health talk earlier as well. So if you do have, don't worry, we'll be here for another couple of more minutes for you to raise your questions. So yeah. Anyway, next week we will also be on talking about the oral care, which will be in the Mandarin version as well. So you can do join us for our Mandarin version of the oral health talk next Monday at 2 p.m. Yeah. So Samson, you got any questions or you would like to check in with the residents or participants as well? Oh, I see. For we doing filling, will dentists normally do batch by batch? Okay. Jennifer, I think you are saying that if you have a lot of few of like a cavity that your filling has dropped off, right? So a dentist you do batch by batch, or they will just do one whole shot? Am I getting your question right?
Yeah, actually I was thinking it's like not necessarily that they have dropped off, but then it's like probably, like so many years already, right? And they probably it's time to do new fillings instead. So would dentists normally, like advise you, like, is it time to be done batch by batch or whatever, that kind of thing. Yeah, how do they normally go about it?
So for that, I think like what Samsu has mentioned, go for your dentist check every 6 monthly. So your dentist can actually do a check to ensure to see that your amalgam filling or your normal that filling need to be changed or not.
Okay.
For your like what I shared, the first time when you see the dental, right? They will review all your teeth one by one. That's why sometimes you can see they say numbers. What number? This one, this one. The assistant will record it down. Then eventually you have to do X-ray. Then they start reviewing. Once they start reviewing, then they will discuss about the plan, how to solve your problem. But normally for holes, and then if they got multiple, it also depends. You see, they can solve one problem, and then there's another problem we start to come. So they have to discuss with you, and then cost also and a factor also lah. Of course, if the whole and then it takes so costly, of course they have to discuss with you also lah. But don't worry, I think the dental, they are very professional, and then they will discuss with you before they start doing anything lah.
Yeah, Jennifer, hope this answer your questions regarding the refilling of
Also,
the.
just curious if, like, if there's like I mean, if there's like certain teeth that you think there's cracks in it, right? So I mean, it's like what are the possible or suggested ways that people would how should I say, make the teeth not so sensitive to pain or something?
Okay, about crack, in fact, I also experienced it before last year. If there is a crack, okay, it's good for you to check with the doctor. You know why? Because if there is a crack, and then your food actually can go in between, and then a lot of other problems will start to come. Then we will discuss with you, and then they will try to patch it back. They will try your best to patch it back. Then after that, you have to revisit again, probably around 3 months, and you're supposed to observe during that period of time whether does it gets better or not. They will advise you, please come back if the thing gets so bad. So eventually, after the 3 months, right, and there is no issue, they review, then it's fine. Then after the next regular checkup, they also observe again, see whether the crack will actually, the one that they paste, does it is it well? Is there anything for them to refill it back? Yeah. But like what I say, still go to the dental. Get them. They will give you a better advice to see whether they can save the teeth or not. It's no point for you to keep the crack when you want to play with the hoping that disease will never come. I think we don't go that way lah. We don't go that road. I think best to get the professional advice. Yes.
I guess when as we age, right? When we brush teeth, like you see when you rinse, you normally see blood, that means bleeding, right? Gum bleeding. And it's common, I mean, for elderly.
It's not common actually, but sometimes it's good for you. Don't panic. Don't go straight away the next day go to the dental, but I say observe first. Does it gets better? Sometimes it's the food that go in between your gum that cause the injuries, cause trauma to the gum. But sometimes when you brush too hard, then after that it heal, but eventually when you brush and then your mouth is dry and you start brushing and then the blood start to come out. So it's good for you to observe first. If every time you brush your teeth or every time you rinse your teeth and then you still bleed, go and see the dental.
Yeah, that's right. So when there's a bleeding of gum, so like there's a lot of factors that might affect the bleeding of gum, like what Samson mentioned. If you brush too hard, so what was advised is to use a softer toothbrush for you to brush it off, and try to brush a bit of the gum as well. Sometimes when it's bleeding, continue to brush it softly so that allow it to heal, and also the food stuck. So like what she shared, use a floss or maybe an interdentine toothbrush to actually go between your teeth gap as well, so that you can brush off the food stuck as well to have a cleaner teeth, and then observe for 1 or 2 weeks to see if the bleeding actually subside, or if it still persistently continues with a lot of bleeding, then do go and see a dentist on it as well. So it might be a deeper issues that you're actually facing. Yep. So like we share, I think that this is also a very scary moment for all of us, I believe. It's like all the drilling and all the handset that they are using, but do know prevention is better than cure. So go for our scaling and polishing very often, rather than when they start to drill your teeth to actually fill out for nerve, or those endo treatment or peri treatment, it will be even painful. So cleaning of our oral health is actually important steps as well. Okay, we hope we answer all of your questions today. So if there's no more other questions, once again, thank you Samsu for the sharing, and thank you for Dashri as well.
Thank you very much. I'm happy.
Thank you for listening.
Yeah, so if there's no more questions, then those who are joining us next week for our Mandarin version, we'll see you next week. If not, we will see you all in another 2 weeks' time. So, Daisy, on your camera, you got any question to ask us? I don't have. Okay. Okay. So thank you all. Have a good day ahead. Bye-bye.
Bye-bye. Thank you.
Bye, everybody.
Bye. Thank you.
Bye-bye. So